good to go? Camera? Camera?
Yes, thank you very much, viewers. As you are watching live again, the Minister of
We are
Health
all
and
observing the social
Dr. Ahmed Lamin Samate is seated and ready to update brief the media on the latest situation of the coronavirus. We can go live to Banjul. Yes, as I was saying, of course, the Minister is ready now to update the media on the situation of the coronavirus in the country. Short while ago, we were, of course, live again, updating you on the situation. Probably what to expect this afternoon from the minister. And yesterday, of course, it was the Director of Health who, updated the media. So now we will go live.
Honorable Minister of Health, Honorable Hamid Lamin Samate, will give you an update as usual, give you a press release to inform you and your audience as to what we are doing. And we also want to thank you for the hard work since we started, and you've been very regular, and we want you to maintain and then for us to work together so that we can also be able to do a lot in the fight against coronavirus in the Gambia, or COVID-19 in the Gambia. So, Honorable Minister, you have now the floor to read out your press release to the general public with regard to an update on the COVID-19 activities.
Thank you very much. Good afternoon to you all. We thank you again for coming. The Ministry of Health would like to inform the general public that the Ministry is working closely with partners to strengthen the COVID-19 response efforts. The 8th National Situation Report since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020 revealed the following. 1. Samples are collected from high-risk contacts of the Numuel case, and the compound remains under quarantine. However, frontline health workers are in dialogue with the community to be able to move the members to one of the quarantine centers. 2. A few samples have tested positive. We all know about the positive cases. However, in Numuel, apart from this index case that tested positive, the people who have been tested have so far all tested negative. 5 new samples were also tested, and they all were negative, that is from the other communities. However, we want to make it clear that a repeat test is being conducted on one of the cases from Bangladesh, whose test result was equivocal. So a repeat is being conducted as we speak. Cumulatively, the country still has a total of 3 positive cases, 1 probable case. It is important for us to also note that all 3 confirmed cases were imported with no epidemiological link to each other. We also wish to inform you that the index case and the URR case are both still under hospitalization and stable and responding to the treatment that they are being given. The regional situation, as we all know, the COVID-19 pandemic is going worldwide, And as of 26 March 2020, 43 African countries, including the Gambia, reported confirmed cases of COVID-19. Senegal, the Gambia's only immediate neighbor, reported 105 cases. The first set of cases in the affected African countries were imported. However, local transmission is now on the increase. Globally, the situation since the 31st December 2019 and as at 26 March 2020, a total of over 500,000 positive cases of COVID-19 were identified, and these were reported in 196 countries. Of these, there were over 23,500 deaths, which puts the crude fatality rate at 4.51%. Currently, we have 215 people on quarantine in various hotels in the country, and they are all safe and in good condition. In addition, 310 people completed follow-up. Those were the asymptomatic people with a travel history to affected countries, and 123 contacts were traced. A total of 57 tests were conducted, of which 3 were positive. 53 test results were negative, and currently we have 1 inconclusive test result which is being reported for confirmation. We would like to appeal to the general public for their continuous support and collaboration in the successful implementation of the COVID-19 surveillance, including contact tracing, rapid response, and risk communication to strengthen community-based surveillance at all levels. I would like to take this great opportunity on behalf of the government of the Gambia to thank all health professionals and security personnel for the hard work and sacrifice for the people of this country. We wish to tell the people of this country that COVID-19 is a reality. We should not be complacent. We should protect ourselves, our families, and the entire country. It is not far away. It is in the Gambia, and with certain measures advised by the health professionals, with the help of the Almighty Allah, we will be protected. So let us all take those measures very, very seriously, and we make sure that we teach our people. We send the message across to our families, friends, and the entire nation, so we all stay protected. It is possible with the help of the Almighty Allah, so let us do our best. I wish to thank all the partners, the government departments, the private sector, municipal and area councils, and communities for the support and collaboration in the fight against COVID-19. Together, we can fight COVID-19. I thank you very much for your kind attention.
Thank you very much, Honorable. I now hand to Workers Sankano to facilitate the question and answer session. We only need about 2 minimum questions and 3 maximum questions if possible. But I'm sure with what we heard from him now, that will also lessen the question. But the floor will be open by Mr. Sankano to facilitate. Mr. Sankano will kindly facilitate. Thank you, Director Maria. Thank you very much for this award. The voice is really encouraged for all of us. Thank you very much for giving us in this topic against invisible for the people. Thank you very much for joining us in today's meeting, and the floor is open for 2 maximum 3 questions. Yeah, the gentleman from Africa.
Ibrahim Ba from Africa TV. Honorable Minister, on the speech of President Adam Barrow on the 17th March, he made pledges to suspend form and empower the minister that is new to definitely utilize form and respond to his side. So far, how much has been and what? The other question is, we know that public gathering has been banned and the call is for social distancing, but we know, apart from the National Assembly and PRRC, many other institutions, including the ministry, is working. How is this, collaborating? Because we think that still now people are gathering in workplaces. Is this also part of the ministry recommendation that work should continue in this way?
Thank you very much for the question. Yes, funds have been pledged for the support of the COVID-19 response, and the process of implementation has started. But of course, with government funds, there are a lot of rules regarding government procurement, and those rules are being followed. As we speak, I cannot tell you exactly what has been spent. As time goes on, we'll be getting summaries, but as we speak, I cannot say exactly how much has been spent. But what I know is various items have been procured. The sanitary materials have been procured. Sanitizers have been procured. Water containers have been procured. Protective materials have been procured. The quarantine centers are being paid for. Food and various items have been provided for the quarantine people. Our response teams are equally being taken care of. So there is a lot that needs to be done. And importantly, also the response teams need vehicles, and that procurement is also on, so that when they are called, they can respond without delaying. So a lot of activities are happening, and we are also renovating the centers where these patients are going to be held. A lot of work is going on. If you did pass by the sanatorium, which is going to be a treatment center, a lot of work is going on. So a lot of activities are currently undergoing. Of course, all that is going to be, from those funds. Yeah. Now, the social distancing is very, very important, because we keep on saying, for communicable diseases, being away from the